Good morning. I'm delighted to be here, to be with all of you stewards. And you may think that vaccines are a little bit out of step with what you've been hearing, but I think they're very much in step because all the infections that we can prevent, we don't have to treat. So I'm going to talk with you about some of the issues that vaccine preventable diseases bring to antimicrobial stewardship. But I'm going to focus mostly on how we're going to rebuild vaccine confidence in this very difficult era of misinformation. All right, let's see. Okay. I have several disclosures that I think are important for you to understand. One is that for the past 20 years, I've been working very closely with the CDC on vaccine safety and addressing specific questions that the providers have about vaccine adverse events. I've also been working with young investigators to try and help them understand vaccines. And I've also been working currently on a lot of safety and monitoring committees that really focus on adverse events associated with vaccines. Do they happen and why do they happen? So I think that I'd like to bring with you some credibility in terms of assessing safety and addressing some of these myths. So what we're going to talk about today is first to give you a little bird's eye view of the challenges that we've had in the past 18 months with vaccine confidence. I'm going to go over some of the major reasons why parents and adults decline vaccinations. I'm going to recognize the central role of providers, of you and the people in the trenches in really promoting vaccinations, because I'm going to show you that you are the most important people in this. And then I'm going to go over some approaches that have been used that really show that ways to increase vaccine acceptance. These will be more pediatric based because we have seen the greatest erosion in pediatric vaccine records. But I think that the principles will be helpful in you addressing the issues that you face with adults and with the chronic care facilities as well. So at the end of the pandemic, the New York City Department of Public Health put out an assessment of where we stood for vaccine preventable diseases. So this is in New York City. So in 1923, before most of the vaccines were available, you'll see the numbers of cases and the numbers of deaths. You'll see in 2023 the numbers of cases and the numbers of deaths. And in the red boxes, you'll see the enormous impact that vaccines have had on these preventable diseases: diphtheria, measles, mumps, pertussis, polio, rubella, and smallpox. So I think we all would agree that vaccines have, other than clean water, have probably had the major impact on preventing disease and keeping people healthy. And we can't forget that most of the American families actually, and American people, believe the importance of vaccine and keeping their children and communities safe. So we can't lose the forest for the trees. But we're going to talk a little bit about the trees now. So what are the challenges? Well, in the last 18 months, a number of things have happened. And you'll see here, our data collection has been threatened in terms of funding for actually conducting surveillance on vaccine preventable diseases. We have had outbreaks of whooping cough killing 2 babies where the mothers didn't know that they were to be given vaccines in pregnancy. We've had changes in misinformation about the link of autism and measles. We have had large funding put back, and we've had a number of issues. The ACIP has been fired and rehired with people that are not vaccine experts. And again, over and over, we have had a number of challenges. We also have had a number of legislative challenges, and these show on the left, the dark orange are those states where vaccine mandates for health, for schools and other environments have been critically challenged. So these are areas where there's really erosion of the legislative support And a number of these, as in Florida, have been overturned. The mandates have been overturned. Now, you are white in terms of not much activity, but this is for 2022, and I'm not sure exactly what's been happening in the last several years. On the right, you'll see the anti-vaccine funding, and this is about $60 million that was devoted to anti-vaccine campaigns in 2022. And if you'll notice there, the purple, which is about a third of this funding, comes from the Children's Health Defense, which was the organization that our current HHS director led. So there is a large amount of money being spent for anti-vaccine campaigns. We also know, shown on the top of this slide, that HHS has done a number of things that have been very problematic. Number one, in May of 2025, they directed that COVID vaccines shouldn't be given to pregnant women or to children. And then in June, they voted to recommend changes to thimerosal-containing vaccines. In September, they recommended changes in MMRV and COVID. In December, they suggested that infant vaccination for hepatitis B should not be conducted. And finally, in January, there was a proclamation that we would take the 17 recommended vaccines, remove 6 of them, and try and emulate the healthcare and vaccine delivery in the country of Denmark. We also know that a number of issues have occurred, but the Academy of Pediatrics sued Kennedy, and we now have an injunction so that there will be no more ACIP recommendations at this point. We will need to have a new ACIP, and at this point, these recommendations have not been implemented. And by and large, the recommendations which many states are adhering to for children are those in the American Academy of Pediatrics, for adults in the American Academy of Family Practice, and for pregnant women in the American College of Obstetrics and Gynecology. So what has happened? Science has been sidelined, trusted processes have been dismantled, the public health workforce has been decimated, about a third of the CDC has been let go, the leadership is spreading falsehoods, and public trust is eroding. So what can we do about it? Well, what are the implications of these challenges? And I think I'm just going to briefly go over a couple of them, but you are very well aware of them. Now, in 2026, we have as many measles cases in half of the year as we had all last year, so that the measles trajectory is going up. We know that there are hot spots in Utah and South Carolina, and there are large measles outbreaks in those areas. We know last year that Texas was the hot spot, but we know that there are other areas that have not seen yet. We hadn't had any measles cases in Tennessee until this weekend when we had 2. And I know from your wonderful reports from your health department that you are facing challenges in Illinois and addressing them very appropriately. We know that the reason that these cases are occurring is largely that the vaccination rates have dropped below 95%. 95% is really the magic number for measles. You need to have 95% of the population immunized, or the virus will begin to accelerate and infect. And we know that some areas in this country, in small pockets, have measles vaccination rates that are closer to 50%. We know that even those that are vaccinated occasionally can get measles, but in general, their severity is much less. We know that 6% of the cases of measles were associated with hospitalizations. We know that there have been 3 deaths, 2 in children and 1 in adults. This is a map that talks about what has happened in measles vaccination rates since the pandemic. And you'll see here that these are kindergarten classrooms. And this means that more than 70% of the counties in the United States no longer have 95% vaccination rates. So the whole country is really at risk for measles. You'll see here the red means the rates of decrease decrease, and the darkest red are 20% decreases since 2019. So since the pandemic, those areas, and you'll see that there are a lot of them are focused on the West. We know also, if you look at the measles vaccination rates from 2019, shown on the left, to 2025, shown on the right, that the number of states that have over 95% vaccination has gone from 20 in 2019 to now only 10. And we know in those areas where less than 90% had gone from 3 in 2019 to 16 in the latest report. So again, we know that these areas are increasing. In Chicago, the data suggests that that prior to the pandemic, that the 95% rate of immunizations was around 92%. And since the pandemic, the rate of kindergarten vaccination is around 85. So these are data from the Kaiser Foundation that were recently released. So what is the cause? Well, I think the causes are clearly shown here in the definition of hesitancy. Hesitancy is a behavior influenced by lack of confidence. They don't trust the vaccine. They don't trust the safety. They don't trust the messenger. They don't trust the government. Hopefully, they trust you. They do not believe that there's a need for the vaccine. We don't need the vaccine. We don't, measles isn't a big deal, but we know that it is. They've never seen polio. They didn't have a case of polio in a sibling of their classmate like I did. And so they haven't seen these diseases. So that's another thing. They don't really believe they're important. Convenience. And I was talking to Hillary before this started about some of the challenges that you face in giving vaccines to long-term care facilities in terms of access and funding and all of those. Those are impediments. And in the children that are afraid to go to the clinic because they're afraid their families are going to be deported, it's highly unlikely they're going to get their vaccines. And finally, the major issue for a number of these people is that they don't want to be told what to do, that they want to be able to decide what they want to do, even though their database is probably not as broad as we would like. I think this is probably the most important slide that I'm going to show you today, because I think it shows you something very exciting. And let me walk you through it. It's a little bit complicated. So what this is are the beliefs in the myths. So if you look over on the right, you'll see that the people that never believe in vaccine myths, the consistent, and those are in the kind of shaded. Then the usual deniers are shown in the shaded too. So about all parents, about 50% of them really don't believe these myths. And even in parents who've skipped vaccines, probably about 19% don't believe this myth. But look at that big blue group. These are people that really don't know. They've heard these myths. They don't know whether they're real. They don't know whether they believe them. They really are ripe for education and your input. And if you look at the children who have kept up to date, they still have 30% of people that have questions. And the people that have skipped vaccines, 45%. But overall, a third of the people have questions about vaccines that you can help answer. There's a range of certainly there are people that support all vaccines, that go along, that cautiously accept, that are kind of fence setters, they don't know, and there are refusals. And you have to realize that all people are heterogeneous. Don't go in and say, have the same view of each patient. Look at each family, each patient individually. They are individuals and they have different views of vaccines, and you have to realize that. Now, sometimes as I get older, I like to look back in history and I like to remind myself, well, has this ever happened again? And this is a cartoon taken from the late 1700s when Jenner was giving cowpox vaccine for smallpox to all of these people. And what do you see? They were growing cow-like parts. Someone had a cow from his derriere, another one had from her knee. So the vaccine skepticism and hesitancy has always been there. It's not something new. It's something that was there in the 1700s. So what are we going to do about this? Well, we're going to debunk these myths by being the best debunker that we can. Who is the best debunker? The provider of healthcare to these patients. How do you be a good debunker? Well, first you respond in real time. If they have a question, you don't wait till next week to answer it. You answer it now. You use facts. You're accurate. You provide content that's credible. You're nice. You're authentic. You have some humor. You come in a way, you emphasize gaps in logic and flawed strategies, and you address everyone in a very respectful, general way that you would anyone that you respect. So you need to set the stage for trust. You need to connect human to human. You look at the patient, you look at and you respect them. You make no assumptions about what they believe, and you ask questions, and you wait to listen for their answers, and you wait to listen for their questions. Heidi Larson is an anthropologist who's probably done the most research about why people are hesitant. And the most common thing that she said, that the most important thing of all is that people don't think you're listening to their concerns. And the more that you listen and specifically respond to what they're saying, the better off you're going to be. And I think all of us sometimes tend to talk over people and not listen and not respond to exactly what they've asked us. Now, this is an interesting study that was done a number of years ago, about a decade ago, by Doug Opel in the state of Washington. In Seattle. And there's a lot of, kind of anti-vaccine granola types in Seattle. And he went out to the practicing pediatricians, and he just sat there and listened to them as they delivered vaccine information to the people. And what he found out, who initiated the vaccination recommendation. So most of the time it was the provider that initiated, although not always. And sometimes it was the parent, 13%, and sometimes in a visit that's going to be devoted at least to somewhat to vaccine, it wasn't even discussed. So obviously you have to bring this up, and that's interesting. But the most interesting of all was that depending upon how the provider initiated the recommendation, it made an enormous difference what happened. So if the provider was presumptive and said, today Susie is going to get 3 vaccines, often with that presumptive approach where it was used 74% of the time, 74% of the time it was accepted. So it was accepted in the majority of the time. However, if you said, today we're going to decide whether you want your child to get vaccinations, that happened 26% of the time, and 4% of the population accepted the vaccines. So how you present it is critically important and is really something that's going to be a foundation for what I'm going to tell you next. So the culture of a presumptive approach needs to begin in the front desk, go through the nursing assistants or nurses, and then through the provider. Vaccines are due today. We're going to set the vaccines up. We're going to give the vaccines today, and I'm going to answer any questions that you have. Now, the other thing that you need to understand is that these vaccines have all been tested at great length. They've gone through animal studies. They've gone phase 1, phase 2, phase 3 studies. I've done all of those things, and we meticulously assess the safety. We really have looked at the vaccines very carefully. They're licensed then, and then there is also a lot of post-licensure safety assessment and input. So the vaccines are being always analyzed for safety. And you have to make sure that the patients understand that we're not just licensing a vaccine and forgetting about it and not following it. Now, I'm going to suggest to you an article that I think that you should all get if you're giving vaccines, and you should share it in your whole environment. And this is something that the Academy of Pediatrics put together in this last year in 2024. The lead author is Sean O'Leary, who was the Red Book Committee chairman from the AAP, Doug Opel, who did that study about participation and making sure that people knew that they wanted to get the vaccine. And Jesse Heckel is someone who's been a provider of vaccines for nearly 50 years. So these are people that have been out in the trenches, and really it's a wonderful article. I'm going to steal a few little points from it. The first of all, I think we also need to participate in adverse event reporting. So if there is an adverse event that happens after the vaccine, it does need to be reported to VAERS, and that is an online situation, and it can be done. And certainly there are other vaccine safety data link and the BEST system. Those are large link databases that are always looking for vaccine adverse events. Those are funded by CDC and the FDA. But finally, there's also something called a clinical immunization assessment network where you can call in and ask about questions if you have adverse events and talk to somebody. I worked on that for 20 years during COVID every single day, including the weekends. For 2 years, I answered calls about adverse events associated with COVID. So we are here to help you if you have questions. Now, there are a lot of common myths, and I'm not going to go over them, but you're going to need to know answers to these common myths if you're going to talk about vaccines. So in this article, it talks about those. It talks about, always natural is better than the vaccines, better to get the disease than the vaccines, which we know isn't the case. Multiple vaccines don't work, that the diseases are now gone. We know all of those things are not true, but much more detailed information about that, because those are going to be questions you have to be prepared to address. Similarly, vaccines cause all these bad things since autism. That's going to be a very important question that you need to address. And vaccines weaken the immune system. We know that's not the case. We know that one of the most potent suppressors of the immune system is measles virus. We have evidence to suggest that in some children that get measles, the antibody responses that they had to earlier vaccines may indeed be wiped out. And we know that children with measles will often get other infections, bacterial infections. So that's not true. Vaccines support an immune system. And giving too many vaccines at once, or they can be delayed, and we know if they're delayed or not given, what happens? You get disease. So again, these are really important things, and you need to know how to answer these questions. I'm going to give you some websites at the end of this discussion where you can get more information about that. If you have nurse providers or if you have nurse assistants, you can also play and model some of these. You can pretend like you're the mother, and you can pretend like you're the provider, and just kind of go over some of these things. And we do this with our residents to try and make sure that they are comfortable in doing this. So I think it's important that then we're going to go over an actual case and walk through this. So let's start out. Let's start the vaccine conversation. Today, we're going to give 2 shots. So if the parent accepts it, fine, there's no issue. If there's some simple questions, we address that. But if the parent has significant questions, that becomes a little bit more problematic. And we're going to talk about that in just a minute. So indeed, if you provide the recommendations, if they're amenable, you vaccinate. But if they're not amenable, then what we need to do is something called motivational interviewing. And I'm going to go over how you do that in a quick and efficient way. Before we do that, however, I want to make sure that we are ready to be presumptive vaccine recommenders. So your body tone, your body language, and the tone of your voice are really important. You must deliver it with eye contact, shoulders square. Don't be distracted. Know what you're going to do and know what you're going to say. It's really important that the confidence in what you display shows that middle blue group that you know what you're talking about, that you're somebody to be trusted, and there's somebody that they want to sign on and follow. The presumptive format should even be used if the parents have had some resistance. Everyone, medical assistants and other staff, everyone wants to be on that same page. That they all need to have the same approach. And certainly at the end, we don't want to sort of erode that presumptive approach by the parents not saying anything, and you say, well, whatever you want to do is fine. Stick with your guns. It's a little bit like when you're disciplining your kids, they kind of try and wiggle out of stuff, but you have to be firm in terms of what you want to do. So it's really important, these presumptive pearls. So if indeed people do not want to receive the vaccines, then what do we do? Well, first of all, we need to get more information. We need to understand this particular family or this particular person. So we ask open-ended questions that we're going to listen to. We're going to say, so tell me more about what you know. Now, this is going to take time. And, we all know that that's something that we don't have a lot of, but we have to do it. Or you could say, what might be a good reason to vaccinate your child today? Or in your mind, what is the harm if you chose not to vaccinate? You can come up with what you're comfortable with. And there's some suggestions here, but kind of have a way that you're going to do this and something you're comfortable with. And then affirm, don't make the family feel because they're asking questions that they are not good parents. You have to affirm that they are really good parents. You're a good parent. We know you have concern. You've read about this. You always think about your children. So affirm that you are respectful of their relationship with you and with their child. And then you can have some sort of reflections that you can kind of put together. You're frightened about what you read the internet. You're worried. You're the type of person who likes to ask research. So again, engaging in a respectful way in addressing and listening to the questions. Then what you do is you ask them if it would be fine for you to give them some additional information. You're not giving it to them, and always they will say yes because they're respectful of you, but it is respectful for you to say, could I provide you with some information based on what I know? So this question, asking permission, may I share what I know? But then again, saying that ultimately we know that the parent is in control and they ultimately will decide what happens with the child. And that is also important, that they know that there's some autonomy. Now, in this particular example, they walked through a measles case. So the MMR, the provider said, "I'm pretty certain you don't want Johnny to give MMR." Yes. And why was that? Well, because my cousin's daughter got MMR and then she got autism. So you have doubts. Would you mind if I gave you some information and could share? And then you give that information. I'm not sure. I guess it would make sense. Well, what would you like? How would you like to proceed today? I don't know. I guess I'll go ahead. So again, these are kind of interactions, and you can read these over yourself and think a little bit about these. But again, you'll see the mutual respect and listening that's going on. Obviously, taking time and effort, but I think it's clear to the families that this is something that you are engaged in. Another article that you may want to choose is something that appeared in the New England Journal just a few months ago, which is another highlighted case on how you talk to people, and with sort of the same authors. But I think it sort of goes over the same thing, which I'd like to just briefly talk about, and that is you recommend the vaccine, that you ask and you present that as the norm. You ask them to share their concerns. You engage in active listening. You ask open-ended questions, and you reflect and summarize their understanding. You ask them if you could provide them information, and you share your information. You address the concerns. You don't talk about MMR and autism if their question is about immune interference with vaccines. You focus on what their question is and answer it appropriately. If there's a question that you have no earthly idea about how to answer, say that. I don't know, but I know where I can get that information. You could call the CDC CISA line. You could talk to your infectious disease people. You could talk to other people that maybe have had more experience. So don't give an answer if you don't know the answer. Just say that you don't know, but you will find out. Reframe the discussion, also making sure people understand about disease severity, facilitate the discussion, facilitate vaccinations. And we all know that vaccines are going to be delivered much more effectively if you have the vaccine there. If you have to refer the patient to go, 2 miles down the road to get the vaccine, that's going to be a big obstacle. So in all the ways possible, it would be best that you have the vaccine there. And then if you choose in the baby at 2, 4, 6 months, in 2 months, you'll have more conversation. You can also give some additional information from websites. And vaccine recommendations. You are critical to this whole story, and you can be empowered to address these questions in a way that is very effective. As I said before, there are a number of vaccine fact sheets. The AAFP, Family Practitioner, the ACOG, they all have provider information, but they all have patient information. Is very good. We want to make sure that we guide people to the websites that are credible, not to the websites that are not. So that's important. Again, more fact sheets. And immunize.org is another non-governmental organization that provides a lot of information. It provides translations for some language you didn't even know existed for the vaccine information sheet. It provides information for families. It provides little educational vignettes about various vaccines. And it's really a very, very, I'm on the board, so maybe that's a little of conflict, but I feel very, very committed to it because it's really a good source of information. They have been funded by CDC for the last decade. That funding was just terminated last month. And so they will be seeking other funding or seeking NGOs to help them as well. So again, that's a very, very good source. So in summary, then, vaccine hesitancy exists as a spectrum. Most parents are hesitant, want to protect their children, but they have safety or concerns about autonomy. Vaccines included in the routine childhood schedule are recommended and have dramatically decreased the incidence of disease, as I think I have showed you on the first slide. Clinicians remain the most trusted person to administer this information, and you really are impactful in terms of this. Presumptive vaccinations are very important. You must have empathy, patient-centered communication. You need to listen carefully, and you need to maintain rapport. Even when vaccines are declined, you will have additional opportunities to pursue those opportunities. So I would like to end there. I would be most happy. I think I have just a few minutes for some questions, and I would be delighted to answer or try and answer any of your questions. And again, thank you. And please don't ever get discouraged, because public health is health for all of us. And it's really a noble, noble profession. And even though some days I know are hard, it's really important. So don't let anybody get you down. Thank you. Questions? Yes.
So one thing you didn't mention was the role of the payer, the insurance company, and all of that. And what I unfortunately foresee is just like there are non-vaccinated or unvaccinated or vaccinated area.
The payers are,
Payers are eventually also. So what is the head of Cross Blue Shield said? You're not going to pay for the tetanus vaccine. You're not gonna pay for, for nothing. We're not gonna pay for that.
so fortunately, at this particular time, the payment issues for pediatric vaccines are still aligned, that the pharmaceutical companies and and that whole endeavor have all signed on to all of these vaccines being provided and paid for. So fortunately, that has not eroded yet. Yet. I think that but I think it brings up an important point that we need to keep working with, with people that are in the trenches working on this. But I think it's fair to say that the pharmaceutical companies and that insurance companies realize that if you prevent tetanus, it's a whole lot better than having a child in the intensive care unit for 2 months on a ventilator with tetanus. So I think that by and large, I mean, the hospital or the insurance companies they have drunk the Kool-Aid. They know that the vaccine is, so I think that now, whether that will continue, I think we have to keep working on that. I think the issues of payers for older people are more problematic. And and again, I'm a pediatrician, but I'm an older individual, so I sort of understand some of these issues. And so I think those are areas that we have to keep working with. All of the academies are working hard to make sure that the AFP and all of these people are working hard to do that. But at this point, the insurance companies, as we do, believe that giving vaccines is more efficient and more effective and more cost effective than not. So again, that's kind of where we are currently. A great question. Other questions? All right, I'm going to be here the rest of the day. So if you have questions that you kind of wanted to just ask, I'm more than happy to answer them. And I'm also happy to be emailed about questions. And because obviously the last night I was a pediatric resident actually here in Chicago. I was on call at Evanston Hospital, and a very beautiful little girl with red curly hair came in, and she had a stiff neck, and I did an LP, and she had Haemophilus influenza type B meningitis, and no matter what I did, by the morning that she had died. And I vowed that we know that can make antibody to this and it will protect children. And this is not something I want to see is kids dying. So I think that we're all in this together, and please keep up your good work. Thank you so much.